Hi there, this is Dr. Jerry again. I want to go over another topic with you, and it's a question that comes up in the office on occasion, and the question is chiropractic dangerous? Well, the mission of chiropractic is to help sick people get well, as well as to help healthy people function better in the absence of drugs or surgery. When people are asked, what do chiropractors do? The frequent response is, they crack your neck or back. Well, yes, chiropractic spinal manipulation, frequently called an adjustment, often produces an audible popping or cracking noise. This sound is technically known as joint cavitation. It is reported to be caused by the release of a pressure-created gas, either nitrogen or oxygen or carbon dioxide, within the joint. It's the same noise produced when one cracks their knuckles. One common myth is that the cracking or cavitating of a joint will produce arthritis in the joint. This is simply not true. Several scientific studies of joint cavitation dispel this old wives' tale. In fact, studies demonstrate that joint manipulation actually benefits patients with arthritis of the spine. Any type of profession has potential dangerous points to it, and you just have to look at what the side effects may be from treatment that is given. Now, in general, with chiropractic, the side effects are usually mild and are transient. They will generally occur shortly after the first treatment is given, and it's similar to a post-exercise type situation. In other words, you know how the muscles get sore or you get stiff, so that can take place, and that usually occurs anywhere from 10% to 30% of the patients. And it oftentimes occurs more frequently in men than women. Now, the most commonly reported unpleasant reaction is temporary increased pain or stiffness, and that usually disappears or resolves itself within 24 hours. More rare side effects of an adjustment, sometimes a little tiredness, occasional mild little headache will turn on, and occasional little bit of nausea sometimes happens. But again, this is very rare. Spinal manipulation has been found to be safe and effective for any uncomplicated spinal pain syndromes. And more importantly, it may also be a very viable alternative to surgery for lumbar or cervical disc herniations. To make an educated decision about what type of care you want to receive for any type of pain you're going through, you have to consider the relative risks. In other words, the risk compared to what you might do versus not do. Okay, so example, you're taking the option of taking medication for relieving your pain versus getting a chiropractic treatment for relieving your pain. All right? It's common for people to take what are called non-steroid anti-inflammatories. These are things like aspirin, Aleve, Advil. All right, well, the risk for serious side effects from anti-inflammatory drugs is 6,000 to 9,000 times greater than the risk for side effects from spinal manipulation. Meaning the chiropractic care is a much safer alternative than aspirin or other non-steroid anti-inflammatory drugs for treating inflammation and neck and back pain. Interestingly enough, too, studies have been reported that patients receiving chiropractic care were able to reduce their intake of these type of drugs and thus reduce the risk of drug reactions and interactions. So, if someone is trying to avoid surgery for spinal-related problems, your condition is more serious and potential side effects of surgery should be compared with chiropractic. There are studies now that show that chiropractic care often can reduce pressure on a compressed nerve in the low back or neck without surgery. And it can be very safe, very effective, and very workable. So there you go. It is shown that chiropractic is a safe way of treating people. There are some side effects, and now you know what those are. For over 30 years now, Family Life Chiropractic has been helping our community with natural approaches to healthcare. One of our missions has been to guide our patients, their families, and friends to make rational health decisions that will provide them with a pain-free, drug-free, and healthier lifestyle for themselves, their children, and for future generations. I want to thank you for listening to these health tips. If you know of someone who needs help, please share them with them. I also want you to please check back, because I will be continually adding useful information to this site, and there'll be new things I'm sure you'll want to find out about. This is Dr. Jerry signing off.